Hello, this is Dr. Gay from First Look MRI, and this is a 51-year-old female injured their ring finger, and the surgeon sent them over to evaluate the tendons. They had an extensor tendon problem on clinical examination, and so this is a coronal T2 fat sat view. We can see the fourth finger has lots of edema swelling around the proximal interphalangeal joint. There's a little bit of marrow edema here, a little low-grade bone injury. Also the joint capsule along the radial side here looks like it may be strained, a little bit of fluid in the joint. If we go along the palmar aspect to see that flexor tendon, we do see a band here, it looks like the flexor tendon. We can see on short axis images this looks normal. Now if we go to the middle part and towards the dorsal aspect, we see that the edema is more prominent dorsally, and also there's a little bit of fluid here. This is where we should see the extensor tendon. There's a midline component of the extensor tendon called the central slip. It comes over here and attaches right to the base of the middle phalanx. But if we go in this cut, we don't see it. If we go in this cut, we see fluid, so that does not look right. Also, there are lateral bands, so the extensor tendon branches into the central tendon or central slip that should attach here in the middle phalanx, and then it also has lateral bands that come over here along the radial and ulnar aspects and attach on the distal phalanx. And those are very small, really super hard to see, and we're going to look at those on the short axis images, but something looks wrong with the central slip here. Now we're going to go to the short axis images to see if we can see that. This is proximal. As we go distally, we see we have this broad extensor tendon complex with a central slip, and then off to the sides you can see one of the lateral bands here, another lateral band over here. They're very small, hard to see. And distally, this is a lateral band that may be partially torn or attenuated. Right there, it's just not well seen. But those are all very small. But now we're going to go back to that central slip. So this is, again, proximal. We're going to go towards the joint, the PIP joint. And right here we see this dark band, part of the central slip. The next cut, we don't see it. So between here and here, it goes from thick and dark to not very well seen. And then here it looks like it starts back again. So it looks like they have a tear of their central slip right here. Now we're going to go on to another view. Let's put up the sagittal T2 fat sat. And this shows it best. So on this view we can see clearly they have the flexor tendon, looks great. And then the extensor tendon here comes over. And then the central portion, again called the central slip, we can see right where it attaches to the base of the middle phalanx. And you can see here it going over, stops, and there's a little gap, and then it continues over here. So it looks like there's a little tear and uplifting right there. You can see where it attaches. And remember, there are the lateral bands that come off of here, and they go around the sides and attach over here to the distal phalanx. And so this is a ruptured central disc with edema and hemorrhage there beneath it, and then prominent soft tissue swelling. And that's it. So thank you very much.